Hello, and welcome to this deep dive session on managing constipation. This video will cover preventative management, managing established constipation, and managing bowel obstructions. Normal defecation requires several factors: diet adequate in fiber and fluid, normal peristalsis, adequate power in the abdominal and pelvic muscles, a normal rectal and perianal sensation. People approaching at the end of life are normally deficient in many of these, and so constipation is a common issue. It is made worse by opioids and anticholinergic drugs commonly used in palliative care. I have here for your reference a diagram showing the anatomy of the lower digestive system, just to help with the slides that we're going to go through. Patients with minimal oral intake will still require prophylaxis against constipation. Constipation can lead to considerable patient suffering and have an exacerbating effect on other symptoms like nausea, energy, appetite, and pain. Pharmacological management of constipation needs to address the cause of the complaint. In most cases, this is reduced peristalsis and an inability to expel hard feces. Hence, the most useful laxatives are those that increase peristalsis and soften the stool. As mentioned, prophylaxis is an essential part of managing constipation in palliative care patients. Here is an example of a preventative laxative regime. It is important for the client to be started on only one of these initially, and changes to be made gradually so as to accurately assess the effectiveness of the medication. It will often take 12 to 24 hours for the full effect for one of these laxatives to become apparent. It is very important to establish the reason for constipation before deciding on the treatment. Examination is vital and can include a rectal examination and sometimes abdominal x-ray, good history taking, and or discussions with team members caring for the resident and use of the Bristol stool chart. Is the constipation a new thing? Has it coincided with the introduction of medications, especially analgesia? Is it localized? Simple palpation of the abdomen can reveal specific locations of pain or hardness which may coincide with a tumor mass or previous abdo scarring or surgery. Osmotic laxatives, like lactulose, draw water into the bowel lumen. They maintain or increase the moisture content of the stool and increase overall stool volume. This may lead to abdominal discomfort and cramping. Lactulose should not be used in patients whose fluid intake is poor. Here we have a regime recommendation for people with established constipation. If fecal impaction is suspected, fecal softening and rectal lubrication are essential for effective evacuation. Bowel obstruction is a relatively common thing for patients with cancer, especially gastrointestinal and gynecological. Clinical procedure of malignant bowel obstruction depends on the level of the obstruction. It is common, particularly in ovarian cancers, to have multiple levels of obstruction, both high and low. Patients with a high obstruction generally have a limited prognosis. Management of a bowel obstruction may be surgical, like a resection, stent insertion, or bypass of the lesion. However, if multiple lesions of obstruction are present, this may not resolve the issues. The addition of dexamethasone may reduce tumor edema or improve symptoms. If the patient is not well enough for a procedure, try reducing parenteral fluids, withdrawing stimulant laxatives, controlling symptoms of pain and nausea, reducing volumes of gastric secretions with medications like ranitidine. You can use gastric decompression by nasogastric suctioning if vomiting large volumes. Key points from this presentation are that constipation is a common issue in people approaching the end of life. People with minimal oral intake still require prophylaxis against constipation. It is important to establish the reason for constipation before you decide on the best treatment options. And constipation can severely affect a person's quality of life and impact other symptoms like pain, nausea, appetite, energy, and low mood. Thank you for listening to this presentation.